You're welcome back. The show is Rise and Shine Daily, reaching you from the stables of Spectrum Television. Yeah, we've been talking about Omicron variants, and right about now we have a guest in the house.
That's correct. In the person of Dr. Rhoda Asoko, a medical officer with one of the Akwa Ibom State-owned passionate hospital. Okay, Akwa Ibom State Hospital, and she's passionate about public sensitization, and also she's an advocate for sickle cell and child care. You're welcome to the show.
Thank you very much.
Nice to have you.
Nice to meet you as well.
Okay,
You're looking
doctor.
calm and collected.
Somebody has to be.
You have to really calm.
Are you feeling for this COVID stuff that's happening everywhere? Is that why you come?
Oh, is it the band?
Yeah.
I'm sure when I want to go, they will lift it.
Oh, we pray so. You're welcome.
So.
Okay, let's quickly talk about Omicron variant. Yeah, we understand that we have cases here already in Nigeria.
Okay.
And what really distinguishes it from the other variants, the Delta variant and the Covid-19, as it were?
Okay, there's really no, for now, I think it's just preliminary suggestions everywhere.
Okay.
I think it's just because of the fact that the Omicron variant has a high mutation level compared to the rest. I think it's really been compared to Delta.
Okay.
It has over 50 mutations, so there's this suggestion that it may be much more infective than every other variant out there. And then, of course, with coupled with the fact that the readings, like the level of infection, number of persons that have been infected worldwide, like it's on the increase.
Yeah.
So that's more further buttressing the fact that it may have a higher level of transmission and infection compared to the rest of the variant.
Okay, let's dive a little bit into the travel ban. Do you support the travel ban that is already implemented, in different countries?
I want to hear that.
Yeah.
Following the fact that, this Omicron variant is no respecter of borders.
Well, I don't like the fact that, I don't even like the way they are going about it.
Okay.
I mean, just before I came here, I was watching on Arise News. A lot of people were very disgruntled over the fact that UK actually banned Nigeria. Looking at the fact that we just have three cases. I mean, compared to the number of cases in even the UK, I don't think it's actually a good thing that we are banned from the countries that even have higher index than us.
Now, on the other note, let's look at it from another perspective. Do you think that, or won't you buy the school of thought that maybe, the ban is for our own good?
Oh, well, it will be for our own good if we too, ban UK.
Okay.
So that there's no entry, there's no exit. Okay. So we can now lay everything out and now know and weigh the options, the good and the bad, to see how it is. Because if we are still having people somehow coming into Nigeria from their own route, there's a tendency, because they have a higher infection rate, there's a tendency that they will come here and infect us.
Okay.
So the same way they are banning us with our only 3 number, we should ban them with their over 100, or is it, I think they have 90 something or so, something. I'm not sure.
Okay. Now let's talk about things leading to this. Just before we got to the Delta variant, there were a lot of health protocols that were usually observed nationwide, so to speak. As it stands, that has reduced to a large extent.
Yes.
Now, would you say that that this people not observing COVID-19 protocols has a way, or has affected, or has contributed to this mutation of this virus thus far?
Mutation, we shouldn't mix those things up, because mutation has to do with genomics, that's genetics, and the protein, the way a variant or the variant is being looked at.
Okay.
But as regards the spread, we're talking about the spread of the virus, or we're talking about the Omicron variant. Like I told you already, that it's it has this high ability to mutate and has a very high transmissible character or ability.
Okay.
So, well, it doesn't really have, I don't think it has anything to do with the fact that we've all dropped our guard, because guess what? It's actually been linked to, in fact, I think there's a study that said those who have been infected before with Delta variant, I think Beta and Delta variant, have a high tendency of getting a reinfection with Omicron variant, irrespective of the fact that they have been vaccinated.
Okay.
I don't know if that has been able to actually like summarize the whole thing.
So what's the place of vaccination if someone who has been vaccinated against a particular virus still has chances of contacting the virus?
Well, I will try to use measles, apart from the fact that this is a novel virus that we are still trying to deal with. Things are coming up every single day. I know you've seen it on the news, different things and different news. Sometimes some things that came up, the debunk, is a debunking, and then new stuff's coming out. If you want to look at measles vaccination, I mean, I didn't have, I had the vaccination, right? But I didn't come down with measles as a child, even as an adult. But we have kids that had the vaccination, still came down with measles. The only thing is that the way measles would have affected the child had reduced or was reduced because of
The vaccination.
So it's the same thing that is ongoing here. It doesn't mean that you may not, of course, you can't, you've been seeing it, people are vaccinated. I have completed my vaccination, okay? But it doesn't mean that I may not be infected with the COVID-19 virus, okay? But the only thing is that the way it's going to affect me would be reduced compared to when I maybe if I wasn't vaccinated.
Yeah.
Okay.
Now, in your opinion, I see that you're pretty much not comfortable with the travel bans. So, yeah, how would you now, how do you think Nigeria can tackle this particular issue if we don't have to protect our borders? I mean, you said we have just 3 cases here. So, and there are countries that have over 100 or thereabout. So, if we don't protect, if we don't stop going there, because it's either ways, they have banned us, that means most of our people will be traveling there, and they're about not contacting the virus. So, if you're not buying that, you're not comfortable with that, how else? What would be your recommendations as a medical practitioner?
For me, whether we like it or yes, there's COVID-19.
Okay.
We're in the hospital. I'm not even scared of the virus anymore because I don't know the number of times I've been infected with it.
Okay.
Are you serious?
Yes. Do you know why?
It's
the truth. You can't say because you've been vaccinated doesn't mean that you're not going to. Well, you may just have a less reaction or a less impact on you.
Right.
What I'm trying to say is that I don't think we should be afraid of anything. We should be afraid of the virus.
Okay.
So as long if we get vaccinated, we get our booster, even peradventure you get infected with it, it's going to be on a lesser way. And also another suggestion or another study has also shown that irrespective of the fact that the Omicron variant is very effective, it also has a lesser severity compared to the rest of the variant, although it's not been conclusive, but it's every other thing is still inconclusive. But these other suggestions also suggest that it has a reduced severity, right?
Okay. Now the World Health Organization have tagged this Omicron variant as a variant or a virus of concern. Why so?
Okay. I think we have 5 variants of concern.
Okay.
That's the alpha, the beta, the gamma, the delta, and now we have the Omicron. I think the reason why it's been tagged a variant of concern as well as the other 4 is because of this stuff we're still talking about, the over 50 mutative ability of this variant, to replicate, and it has a very high infectivity index. So that's why it is a variant of concern.
So will this ever stop? Just keep saying variants.
I like the fact that I'm a medical. I like the fact that I'm a medical doctor. Maybe I'll have to go and study genomics, study other things, and then go ahead.
Okay.
Maybe when I'm back, and then maybe I would have to.
You respond to that.
Okay.
I get it.
Let's look at Nigeria as a country, facing this off, I mean,
Right.
we faced COVID-19 and we
Right.
called for a lockdown. Do you see another lockdown coming soon because of this? Do you see that?
Well, if Nigeria applies, it's unfortunate, but I know I actually wanted to travel.
Oh, Lord.
Oh, maybe that's why you're not comfortable.
But the truth is, I think if Nigeria also places a ban,
Okay.
and we are not stubborn,
Okay.
the government also sees the need to place the ban, and then as a country, our structure is being laid properly.
That's
You know,
right.
we strategize at different levels. You understand? We unlearn and relearn, and this, I mean, done early enough.
Okay.
We should be able to curtail this. And then secondly, if Nigerians increase the way they get vaccinated,
That's right.
that's another thing, because we have a lot of persons that are not vaccinated up till now, despite the fact that we've been shouting. And then also we also adhere to the different COVID-19 guidelines. We should be able to.
Okay, let's quickly get your last words. Now, given that a lot of people have been vaccinated and we still have much more who are not yet vaccinated, and we feel that, or reports say that they are kind of prone to, contacting or catching this, Omicron. Now, what would be your advice to the public?
Well, I would say the public should get vaccinated. There's nothing wrong with vaccination. I have been vaccinated. My DNA has not changed, and I'm sure when I want to put to birth, it's not going to affect my fertility and other myths and misconceptions. So please be vaccinated if you've not been vaccinated, and continue to keep to the guidelines of COVID-19 protocol.
All right, that has been the size of this interview for now. So we'll take a pause here. Many thanks, Dr. Rhoda, for showing up on our studios. I hope we call on you. You'll be available next time.
Hopefully she doesn't travel by then.
Please don't.
Please don't say that again. It was just for a holiday. Just for a holiday. Now you have to say that. I'm just traveling for a holiday.
Okay. No problem. Okay, that's the size of it right here. When we return, we'll be taking funny videos and we'll call it a wrap. Don't go away. Stay with us.